1. When teaching a patient about nicotine withdrawal, which instructional approach most aligns with adult learning principles? A. Providing a long lecture without engagement. B. Connecting withdrawal symptoms to the patient's daily experiences. C. Giving complex biochemical diagrams. D. Requiring memorization of terminology. 2. During a motivational interviewing session, which technique best promotes patient autonomy? A. Giving direct commands to quit immediately. B. Using open questions that encourage personal reflection. C. Interrupting to give facts quickly. D. Overloading the patient with statistics. 3. When training new tobacco treatment specialists, which evaluation method best measures real counseling competency? A. Written quizzes only. B. Observed role play with a performance rubric. C. Silent reading assignments. D. Attendance tracking. 4. A patient expresses ambivalence about quitting smoking. What communication strategy is most effective? A. Telling them ambivalence means they are not ready. B. Reflecting their feelings and exploring motivations. C. Persuading them aggressively. D. Ignoring the ambivalence. 5. During curriculum development for nicotine replacement therapy education, what should be identified first? Slide colors. B. Learning objectives related to proper dosing and safety. C. Length of the class. D. Quiz difficulty. 6. Federal guidelines require appropriate documentation of cessation sessions. Which action meets compliance? A. Recording session details accurately and securely. B. Sharing patient notes freely with all clinic staff. C. Leaving documentation incomplete. D. Storing notes in personal email. 7. A trainee struggles with explaining behavioral coping strategies to patients. What mentoring technique is most effective? A. Demonstrating the explanation and having the trainee practice. B. Telling them to read more on their own. C. Ignoring the issue to avoid discouragement. D. Correcting them publicly. 8. When teaching about relapse prevention, what method increases retention? A. Providing real-life examples and practice scenarios. B. Reading a chapter silently. C. Memorizing long lists of triggers. D. Listening without interaction. 9. A tobacco treatment specialist encounters a patient with high anxiety about quitting. What approach supports patient-centered care? A. Minimizing their concerns. B. Validating their anxiety and offering coping strategies. C. Pressuring them to quit immediately. D. Avoiding discussion about emotions. 10. In a training program, which assessment best measures knowledge about pharmacotherapy contraindications? A. Case-based multiple choice items. B. Word matching games. C. Peer popularity ranking. Random guessing tasks. 11. A patient smokes to manage stress. Which evidence-based counseling skill should the specialist use? A. Explore alternative coping behaviors and reinforce strengths. B. Ignore the stressor. C. Advise quitting without addressing stress. Recommend stopping stress entirely. 12. When evaluating a trainee's ability to use motivational interviewing, which indicator shows competency? A. Dominating the conversation. B. Increasing patient change talk during dialogue. C. Giving long lectures. D. Correcting the patient frequently. 13. A curriculum for tobacco dependence treatment should A. Align content with nationally recognized treatment guidelines. B. Use only instructor preferences. C. Avoid scientific evidence. D. Focus only on theoretical models. 14. A patient reports using multiple tobacco products. What is the specialist's priority? A. Determining patterns of use to guide treatment planning. B. Focusing only on cigarettes. C. Advising quitting without assessment. D. Ignoring non-cigarette products. 15. A trainer wants to engage adult learners in group cessation classes. Which method is most effective? A. Facilitating group discussion and shared experiences. One-directional lecturing. C. Reading handouts word for word. D. Discouraging participation. 16. A patient declines medication. What is the appropriate specialist response? A. Respect the decision and discuss non-medication strategies. B. Refuse to continue counseling. C. Tell them quitting is impossible without medication. D. Insist they choose a medication immediately. 17. When assessing nicotine dependence, which tool ensures standardized evaluation? Using validated measures such as the Fagerstrom test. B. Guessing based on appearance. C. Asking only one question. D. Allowing each counselor to create unique rules. 18. A trainee uses judgmental language when counseling. What is the best corrective strategy? A. Provide feedback privately with examples of neutral language. B. Criticize them in front of peers. C. Ignore the issue. D. Remove them from training. 19. A tobacco treatment specialist must prioritize ethical standards. Which action demonstrates compliance? A. Maintaining confidentiality of patient information. B. Sharing patient struggles with friends. C. Recording sessions without permission. D. Pressuring patients to change faster. 20. In relapse education, which statement reflects accurate understanding? A. Relapse indicates total failure. B. Relapse can be a learning experience for future planning. C. Relapse means treatment should stop. D. Relapse should not be discussed. 21. When creating educational materials for cessation groups, what enhances adult comprehension? A. Clear, simple visuals with real-world relevance. B. Overly technical charts. C. Long paragraphs without breaks. D. Excessive medical terminology. 22. A patient has low confidence in quitting. Which technique increases self-efficacy? A. Exploring past successes and strengths. B. Emphasizing past failures. C. Telling them confidence does not matter. D. Ignoring their concerns. 23. A trainee must demonstrate skill in discussing medication side effects. Which evaluation method is most accurate? A. Direct observation using a structured checklist. B. Self-reported confidence. C. Random written test. D. Peer voting. 24. When supporting a patient through a quit attempt, which communication strategy strengthens rapport? A. Empathic listening and affirmations. B. Interrupting frequently. C. Providing judgmental statements. D. Giving complex instructions without explanation. 25. Which action ensures regulatory compliance during cessation counseling? A. Providing accurate, informed consent for treatment options. B. Documenting only what the specialist prefers. C. Avoiding discussion of risks. D. Withholding information to prevent worry. 26. A trainer wants to reinforce learning about counseling techniques. Which method is most effective? A. Skills practice followed by immediate feedback. B. Memorizing textbook chapters. C. Watching videos only. Reading aloud. 27. When developing a cessation curriculum for clinicians, which element is essential? A. Aligning content with evidence-based treatment guidelines. B. Eliminating behavioral counseling topics. C. Excluding pharmacotherapy. D. Avoiding learning objectives. 28. A patient is resistant to setting a quit date. What is a recommended approach? A. Explore reasons for resistance and support autonomy. B. Demand a quit date immediately. C. End the session. D. Threaten consequences. 29. When mentoring a trainee, which approach supports long-term skill development? A. Gradually reducing guidance as competence increases. B. Providing no opportunities for independence. C. Doing all work for them. D. Giving one-time instructions only. 30. A patient discloses heavy alcohol use. What should the specialist do? A. Assess how alcohol affects smoking patterns and quitting. B. Ignore the information. C. Focus only on nicotine dependence. D. Advise quitting alcohol first without evaluation. 31. Which patient goal best reflects readiness for change? A. I want to try cutting down first. B. I have no interest in quitting. C. I do not want to discuss smoking. D. Someone else wants me to quit. 32. When coordinating care with medical providers, which communication practice is essential? A. Clear, concise, factual updates. B. Emotional storytelling. C. Vague summaries. D. Informal messaging without documentation. 33. A trainee needs improvement in relapse prevention counseling. What strategy best enhances competency? A. Supervising multiple practice scenarios with structured feedback. B. Giving them a chapter to read. C. Allowing guesswork. D. Avoiding practice. 34. When teaching about nicotine replacement therapy, which method supports mastery? A. Demonstrating proper use and supervising hands-on practice. B. Providing written instructions only. C. Avoiding demonstrations. Using only verbal explanations. 35. A specialist must screen for depression and anxiety because A. Mental health conditions can influence tobacco dependence and relapse risk. B. It is unrelated to tobacco treatment. C. It replaces nicotine dependence assessments. D. It is optional for all patients. 36. A patient states quitting is too hard. Which motivational interviewing response is appropriate? A. It sounds like quitting feels overwhelming at times. B. You should not think that way. C. Just quit anyway. That is not true. 37. A training curriculum should incorporate what element to ensure strong instructional design? A. Sequencing content from basic to advanced concepts. B. Random assignment of topics. C. Overloading learners with details at once. D. Focusing only on advanced content.